Today we are talking about trigeminal neuralgia. It's a chronic disease that can cause sharp pain like a knife right in the face, so severe sometimes it prevents people from eating or drinking. Well, Dr. Ajmal Zemar is our expert here from U of L Health today. Thank you so much for coming on, doctor. We appreciate it.
Thank you for having me.
Let's start talking about this diagnosis a little bit. What's happening with the body when someone's experiencing this?
It's pretty much signs of face pain. So you have electric shock-like pain that comes and goes, and it's very disturbing for patients. Sometimes you have patients who have this so severe that they can't eat. I've seen patients that have lost weight. Just very, very unpleasant to have.
It's hard to imagine. I can understand how that would just turn very unpleasant. Let's talk about who's most at risk and why.
It's a little bit more in females than in men. Pretty much everybody could be at risk. I've seen this with younger patients. It's more so ages 40 and plus.
Okay.
Why? We don't really know. The cause of it is not known. Sometimes it's triggered by cold weather, sometimes it's triggered by eating, sometimes it's triggered by stress. It could be anything. We don't really know why.
And a chronic disease, so once you have it, you have it. Is that right?
That is correct, yes. Once you have it, you have it. There is luckily things we can do about it.
Let's talk about that, treatment options.
All right. So the appropriate visit to a physician would be to see a neurologist first who specializes in this, who would start treatment with medication, most commonly Tegretol. We treat this in about 70% of patients. That takes care of the problem. The remaining 30 would come to see us, neurosurgeons. When medications don't work, we can offer surgery, and there's a few things we can do. One is, the problem is there's a blood vessel that pinches against a nerve and irritates the nerve. So we separate the vessel from the nerve with open surgery and put a pad in between. Another option is not open surgery, but radiation surgery, where radiation targets the problem and you don't have any incision. The third option is we stick in a needle through the cheek to get to the target point and burn it.
Oh my gosh, well that is why you're the expert in doing all of these things, a neurosurgeon with U of L Health. Thank you so much for coming on today, for walking us through this, and for your work in the community. We appreciate it.
Thank you for having me, and if anything, any patients, we would love to have them and see them at U of L. Thank you very much.
Thank you.